Right. Hello everybody, welcome to Anatomy and Physiology 2. Today we're going to be learning about blood vessels, their structures, functions, and where they are. It's basically the who, what, when, where, and why. So, start off, let's take a look at what a blood vessel is. So first, a blood vessel carries your blood across the body. It's either going to be oxygen rich or oxygen poor, depending on what it falls into, aka an artery or a vein. Now, first off, we're going to be looking at the structures of an artery and veins, differences, similarities, and why they're different. So first, let's take a look at an artery. An artery carries oxygen-rich blood when you see it on models, it's going to be red in color. It's due to being oxygenated. Now, arteries also contain muscle fibers. And they can vasoconstrict and vasodilate at will whenever needed. Now veins are blue or green in color. And these are usually more visible on the surface of the skin. Veins carry oxygen-poor blood. And they have less pressure than their counterparts, arteries. Alright, now let's take a look at the structures of an artery and a vein. So, you have your artery, you have your vein. So, artery, vein. So your vein is going to have 3 layers. Tunica, interna, tunica media, and then your tunica externa. Now, your artery is going to have the same structure, 3 layers. Interna, media, and externa. The difference between these two is your vein has elastic fibers in the media, which is the middle. And your artery has muscularis, which is muscle tissue, in the middle, aka the media. Now, the difference between the muscularis and the elastic fibers in these two. The muscularis helps it vasoconstrict and vasodilate drastically more than the vein. The elastic fibers in the vein just keep it a little bit vasoconstricted, just so it can maintain blood pressure and be able to pump to the heart. Now, vasoconstriction and vasodilation. It's almost self-explanatory, but I'll explain it for those who don't know. Vasoconstriction constricts the artery or the vein, and it causes the pressure to go up. Vasodilation dilates the vein, making the lumen larger, causes blood pressure to go down. Now, it's always important that a vein and an artery would always have a little bit of vasoconstriction because if it was completely dilated, you would have no blood pressure, therefore your heart could not pump. Now, let's take a look at where some of these arteries are located, somewhere where these veins are located, and what they're called. In your arm, you are going to have your axillary artery, your brachial artery, and then leading down, it's going to lead to your radial artery, which is in your thumb, or near your thumb, I should say. And then the whole circuit down there is going to be your palmar arch, which your palmar arch is going to be all around here. Now, the veins in your arms could be named a little bit different, but still some of them are going to have the same names as well. You're going to have your cephalic vein, basilar vein, median cuboidal vein. Median cuboidal vein is going to be located right here, right on that little almost square area, just near or on the other side of where your elbow is located. And that's going to lead to your radial vein. Then you have the arch of your veins in your palmar. Then from your arm, you're going up this way. You're going to hit your subclavian vein. Subclavian veins then lead to your axillary, so forth down to your arms, therefore. So let's take a look at our legs and what our legs lead from. So leads from your pelvic girdle, and some important veins and arteries in your pelvic girdle are going to be your common iliac artery and veins. You're going to have common iliac arteries and common iliac veins. Then you're going to also have internal and external common iliac arteries and veins. Internal go in, external go out. From there, we're going to get into the legs. For your arteries in the legs, you have your femoral artery, leads to your popliteal artery. Popliteal artery is in your knee, hence why it says popliteal. That's going to lead to your palmar or plantar arch, which is in the foot, and it's the arch of blood vessels in your foot. Now, the veins in your leg, it's going to be named different. You're going to have your great saphenous vein, and that's going to lead all the way down your leg. No popliteal vein, it's just great saphenous vein, plantar vein. Done. Now, you're going to have the whole line of blood vessels and arteries. Chest, abdomen, mesenteric artery, superior vena cava, inferior vena cava, all those in your chest. You should know about all those from the heart lesson. And there's an important artery in your neck and for your veins as well. That is going to be your carotid artery and carotid vein. You can feel your carotid pulse by feeling right here, just below your mandible. Now, lastly, we're going to be looking at the amount of blood that's in the veins, and the amount of blood that's in your arteries. So, in your veins, you contain 61% of all the blood in your body is currently in your veins. The rest is in your arteries and some in blood plasma. Moving on from that, I believe that'll be all for today. Thank you for listening, and I really hope you learned something from this and that it could be of help. Thank you.